Welcome everyone. This is Kate Fassett with Valleywise Health Foundation. I'm here with Dr. Mitchell, one of our emergency medicine physicians. I'm just so excited to have you. Thank you for joining us today.
Well, thank you for having me.
Oh, we're so thrilled. This is such a great opportunity to share with our donors and our supporters a little bit about some of the physicians at Valleywise and what you do and why you do it. And, you know, obviously there's some unique things happening at the hospital right now, so I'll make sure I touch on those. But I wonder if you could tell us a little bit about yourself, your background, kind of how you ended up in medicine, and then specifically into emergency medicine and as the ultrasound director.
So I grew up in Hot Springs, Arkansas, which is quite far away from here. And when I was a kid, I knew I wanted to become a doctor because I had a good family friend that was a doctor. And so I went on that journey. And I traveled all around in my training from Ohio to California. And then finally, when I decided that I wanted to do a fellowship in emergency ultrasound, an opportunity opened up in Maricopa at Valleywise now. And so I came to Valleywise to do my emergency medicine ultrasound fellowship. And that's how I ended up here.
Interesting. How did you kind of decide when you were in medical school? Was there something specific about emergency medicine that caught your attention, or, you know, was there something in your residency that really felt like this was your calling?
So that's a funny story. So as it happened, I went on a mission for my church to the Dominican Republic, so I learned to speak Spanish. And when I was in medical school, I decided to work as a medical Spanish interpreter. So there was a company that was nearby. I trained with them. I took their exam. And both my wife and I qualified to become a medical Spanish interpreter. And so while I was going to medical school in the morning, I would interpret at night. And sometimes I would even sleep there at the hospital. Most of the time, the interpreter services were at the same hospital that I was doing my training. So I would study for my exam and sleep intermittently and then go to my test.
Oh my
While I was doing this, I was doing this in the emergency department. And I looked around and I just saw the interactions and interplay between the doctors and the patients. And, you know, you kind of have to find something that fits your personality. And I felt like this really kind of fits my personality. I really like their interaction here and the knowledge and what have you. And then at the same time, it has to fit your goals. Mm-hmm. And I really wanted more time to spend with my family when I'm at home. And I wanted to have an interesting and exciting creative environment when I was at work. And this just seemed to make sense. And so when it all came together, I thought, you know, I probably should do emergency medicine.
Interesting. I like that you figured out that work-life balance and, you know, still being challenged, I'm sure, every day, especially now with the work. So we know what brought you to Valleywise. What is it about the system, the patients, that continues to keep you there, and maybe, you know, or the residencies, or, you know, what is it what's your why, I guess?
So, you know, I'm the type of person who loves to learn and likes to be creative, but also too, I think the bigger driving force for me is I like to help people in need. And it sounds cliche, but I really, really do. And I really get a kick out of helping people who are in an underdog situation, because I felt like when I was going through school and everything, to do something amazing. So I enjoy being there with the residents, especially if they're struggling or they're having a hard time kind of getting through the program, and then finding ways to help them discover in themselves the excitement that got them into medicine, and also to the qualities that got them into residency. And then maybe you'll find a way to kind of get through some of the tough rigors of residency and help them become successful. I really enjoy doing that. And it's one of those things that excites me every day. Another thing too is I also enjoy the patient population that we have at Valleywise. I mean, to be honest with you, when I think about the people I see every day, it looks exactly how the people I grew up with when I was kind of growing up myself. And so it kind of feels more comfortable. It feels more like home.
Yeah, that makes sense. Was there somebody, maybe I kind of feel like you're filling that mentor role, it sounds like, with a lot of residents. Did you have somebody during your residency that kind of filled that role for you and has inspired you to serve in that way?
So there was quite a few people, actually. But I guess if I were to put my finger on one person, there's doctor named Manish Amin. He's in the program in Kern, a medical center. And I just really enjoyed his personality, his connection with the patients, his connection with the other colleagues. And so I kind of model a little bit of how I see life and how I interact with the residents off of him. Now he doesn't really know this. I didn't tell him much of that, but I've always appreciated just kind of how he just did himself. And
Mm-hmm.
so I seriously just try to model my experience and the way I talk to the residents and the faculty and the patients off of what I saw him do.
That's awesome. That's really wonderful. I imagine you're being that person for somebody down the road that you had no idea, just like you were saying, he doesn't know that you were touched in that way. So that's incredible. So in that mindset, tell me a little bit about the ultrasound program, why it's so important at Valleywise, and how it became integral in the emergency medicine department and in the residency program.
So now you're getting me excited. So, ultrasound is kind of a funny, amazing thing. I don't know if you were like me when I was a little kid. I always wanted magical powers. I wanted to be able to do something amazing. And when I discovered ultrasound in my emergency medicine training, I felt like I got magical powers because when somebody was suffering and I had some ideas in my head about what might be happening, so I had these questions, it was amazing to me that I could immediately pick up this ultrasound, this magic picture box, sometimes we call it. And with a little bit of training, I could discover what's going on, or I could do some type of procedure and intervene, and wow, I can make the person much better. That was kind of how I got excited about it. One of the things I love doing is nerve blocks. And when people are suffering and we have to do a very painful procedure, because that happens all the time, sometimes it's great to be able to go in with a little bit of pain. I can do this nerve block and then completely relieve all the suffering you had, and I can do whatever procedure I have to do to kind of get you in a better place.
Mm-hmm.
And that's amazing to me. So having ultrasound at Valleywise is super important to me. And I believe it's super important to the residency as well. I feel like I'm teaching magic, to be honest with you. And this magic can really help patients to kind of find an easier route. We have quite a few patients who had various health problems, and sometimes they are hard to get an IV access, where basically we're trying to get an IV into their bloodstream so we can take blood out and we can put medicines in. But with this ultrasound, I can teach these residents to do these procedures where they can go and use the ultrasound to get that IV access and make it a lot easier for people to receive their medications and relieve their suffering. And, it literally looks like magic to the patient. It sometimes looks like magic to me, even though I understand it. So.
Amazing. So obviously things have changed quite drastically over the last few months. So can you give me, maybe if there is such a thing, a typical day now during COVID, and maybe how things have changed in your mindset as far as how the emergency department runs and protocols and all of that from prior, earlier this year, late last year, all of that. I had spoke with Dr. Kwan yesterday, and he kind of told me a lot of things that I found were so interesting. It's just how you're approaching patients and those kinds of things. So I guess if you can share with me just how that's changed and what a typical day might look like.
It's amazing that you asked that question, a typical day, because I'm not so sure we have any more typical days. It's so different almost every day because we have to evolve as the disease evolves in our community. And I will say one thing that has become typical for us is that we can no longer have anybody with just one big complaint. It's always, and I always like to joke with the residents, toe pain and COVID, neck pain and COVID. Everybody is coming positive. We have lots of people who are, have chronic medical conditions, who are getting sick. And unfortunately, we have quite a few people who are not winning this battle. We have people who come in and they're struggling, and now we have to take them into one of our negative pressure rooms where we suck out the air and what have you to to do whatever we have to do with them. And it becomes a very complex case, and we're trying to save as many people as we possibly can. But it is quite hard. And because there's so many people who are sick with the coronavirus, it's making it hard for people who have other medical problems.
Right.
And it's also hard for us to take care of those people with chronic medical conditions or serious medical conditions who also have coronavirus as well. And unfortunately, now we tend to have to do advanced procedures on many patients that to sustain their life because they're coming in and they can't breathe and they can't function, and sometimes we have to breathe for them. We have to sometimes intubate them and put them on a ventilator, or use one of the strong masks we have to breathe for them. And this is a common everyday thing. You know, unfortunately, every time I go to work, I tend to have to do some of those advanced procedures on people to help them breathe, to keep them alive. And sometimes it doesn't work. I would say that, I won't say 50-50, but it's pretty grim sometimes. And it's not a normal thing. I mean, I'm used to struggles and problems in the emergency department, but this is a different world. And it's kind of hard to call it typical because, you know, it kind of evolves and changes all the time, but it's definitely harder.
Do you see this kind of really being a moment in time that could lead to, you know, just a monumental shift in how you do things going forward, even, you know, as we hopefully develop a vaccine and people are, you know, maybe a little bit more thoughtful in their protective measures? How do you see the emergency department changing, you know, going forward, hopefully post-COVID?
Well, I do think it's going to take a while before we can truly say the words post-COVID. But, you know, in a few years, once we get our new norm, you know, I think that we're going to see an ever-growing role. And this has been true before even we had the coronavirus. We see the emergency department taking on the ever-growing role. And now with the coronavirus and us being on the front lines, we're going to see more and more responsibility and leadership in the emergency department, because we're going to have to come up with ways we haven't thought of to manage the influx of patients. Because currently, right now, it's strained, and if the volume of people with the coronavirus and or new other diseases that might be coming out in the world, kind of very similar to this pandemic, we're going to have to see leadership to help us kind of figure out how to manage this new volume, because this is a new volume. We're seeing record numbers of people coming in sick with coronavirus plus their additional medical problems. And there's still plenty of people who are trying to stay at home even though they're suffering because they are afraid to come to the hospital. Those guys eventually have to come back. And so with this new volume coming in, we're going to have to see quite a bit of expansion in the emergency department leadership. We have to see more resources from other of our colleagues in different departments and definitely we're going to definitely need more outside facilities and places to refer people so that we can manage them without bringing them to the hospital, because there's no way we can manage all the people we have to take care of with our current resources. We have to find other avenues, especially for our patients at risk, those who are undocumented or what have you. We're going to have to find ways for them. So we're going to have to, I believe, a greater leadership in the emergency department, a greater collaboration with other departments, and also to maybe more facilities and more options for outpatient management.
That's fascinating. I hadn't really thought of it like that. That's really interesting that you say that. One of the questions that has kind of come to my mind is, you know, obviously this is probably the silver lining for residents is what an incredible time to learn. I mean, they will have an education that most probably wouldn't have had otherwise as far as a residency experience during a pandemic. What is it about Valleywise that makes it such a robust learning environment? And, you know, is it the patient population, or what is it that helps with really creating that robust environment?
You know, there's actually quite a few things, but I would say the things that I value the most are our patient population. You know, we get lots of different kinds of people who show up to Valleywise, And having a diverse population allows for us to see things that maybe you wouldn't otherwise see. I would say that's paramount. Another thing is we recruit very carefully. I mean, we get over 1,500 applications. We whittle that down to 16 people, you know.
That's amazing.
And so we were very careful with our selection. And then at the same time, we have been very careful with curating our faculty. And so if you put all that together in a pot, you get an environment where education is a central role. And then on top of all of that, we have an environment here that doesn't exist everywhere else, that promotes education, that's excited about education, that puts forth money towards education, that puts forth measures for education. Our nurses are all for education. Our techs are all for education. Our housekeepers are all for education. We all know what the program is. And having everybody on board and everybody with the same focus, that's how you can create an environment. That's how you can create an institution. That's how you can create an opportunity for a high quality experience for the residents. So not only do we carefully curate them, but we actually carefully curate our environment so that they can come together and they can have a great experience.
That's really fascinating. How do you think the addition of the Creighton Alliance and just more opportunities for learners, seeing different experiences, will that aid in adding, more to the experience, or just, allowing for more opportunities with additional medical residents? I mean, how will the Creighton Alliance be a part of that?
Well, you said it already. The reality is, and this is true for almost anything, the more diversity that you have, the better your education will be. And this opportunity we have to connect with the Mayo and St. Joseph and multiple other facilities in Creighton, it gives us more opportunities to have different patient populations, which I said in the beginning is paramount when it comes to resident education, and different variety, different specialties and interests. We get to benefit from what they do best. And so we get to do, the residents have opportunity to experience what we do best and what they do best at different other facilities. And that creates for a diverse and broad-based type of learning for our residents. That gives them an opportunity to be flexible. When you're diverse, you can be very flexible and understanding, and new experiences that you may never have seen before are not so scary. They're not so difficult because you understand how to kind of approach these things in multiple different ways. And by doing so, and by being able to do that, it makes it easier for you to grow even far beyond what you actually have available to you in the first place.
Very cool. So I think one of the things at least I love is the stories that come out of Valleywise, not only on the patient side, but things that have touched you. So I want to ask if there's a resident story that has stuck with you, as you mentored somebody along, or a patient story that has really stuck, and that you're, were moved or touched by.
I do have this one story. It's kind of a difficult story to tell because sometimes I get choked up, but I'll be good this time. This was several years ago that we had a young lady come in. She was 75 years old, and she passed away from natural causes. You can tell that she was the matriarch of her family because when she came to the hospital and we did our resuscitation on her, we couldn't bring her back. There was a large number of people who came to our waiting room and outside, and particularly her daughter came and her granddaughter came. Now, we have a bereavement room where people can sit with their loved one and kind of take the time they need to kind of say goodbye. Well, several hours passed, and I think we were in the process of trying to get the body into the next stage. And I noticed that the daughter and the granddaughter haven't left yet, and they were still there. So I went to talk with them, just kind of see what's going on. And while talking with the daughter, she was still not quite convinced that her mom had passed away, had left. And so she felt quite sad and thought, well, maybe is there something else we can do? or am I sure, am I 100% sure that she had passed away? And so realizing her situation and trying to be sensitive to that, I had a thought to come to me, you know, well, how can I help this daughter find peace? Um, and then it occurred to me, I can do the thing that I know how to do that very few people can do really well. Is I can teach her something that maybe will help her to get to the right place. So
Yeah.
I decided to teach her how to do point of care ultrasound. So that might
Oh,
sound kind of
neat.
weird, but let me explain. So I went out, I got my ultrasound out, and I showed her how to ultrasound my heart. And so she saw my heart and she saw it beating, and she was kind of interested. She was kind of curious as to what I was trying to do. Then I showed her how to ultrasound her heart, and she was able to see that, and she was interested, and that was exciting to kind of see her own heart. And then I showed her how to ultrasound her mom's heart,
Oh,
and then so she was
oh,
able to see that her mom's heart was not doing the same thing as our heart was. She spent some time looking at the heart and realizing that it wasn't moving. And she went back to my heart to kind of compare, and back to her heart to compare, and then to her
oh,
mom's heart.
wow. Now you're getting me
And
choked.
then after a few minutes, she said, thank you. And she was grateful. And we walked out the room together, and she was able to look over her mom. She said, I really appreciate your patience. You know, I've been here for a while. I just really need somebody to talk to me and to help.
Wow. You've got me choked up. I think one of the things that, and we hear this a lot, that stands out about Valleywise over other institutions is, one, how humble you all are. I mean, you're so driven by the mission and by what you do, whether it's the teaching, the patients, or a combination of both. But the amount of compassion that everybody has, and it just is, it's unbelievable. It chokes me up to think about what our patients are dealing with and how you guys go above and beyond every day to really, provide them with as much care and compassion as possible. So, wow. Well, thank you. I think I don't know how we keep going from there. That was an incredible story, and I appreciate you sharing that. And I'm so glad that that family had somebody that could really take it to the next level and help them. So, with that, if there's anything else that you want to share that has touched you, or that you're interested in, kind of letting our donor community know about you, about Valleywise, about ultrasound or the emergency department, feel free.
I really don't have much to say except for I really appreciate all the donations they give to kind of help Valleywise be the place it is. I know that they want their money to go and do great things. I believe we're doing great things, and we can do even greater things. And so I appreciate all that they do for us.
Oh, of course. Well, it's an honor for us to share your stories and, and the why and why you do what you do. And thank you for taking the time to join me today. And I know you guys are working so hard right now, so I appreciate you taking the time, and hopefully you can enjoy the rest of your afternoon.
Well, thank you. I appreciate that. You too.